Does everybody really need to take blood pressure on all their patients?
Find out today on Medical History Mysteries.
So we learned in school that we should take blood pressure on all of our patients. And I think some of us do. Maybe it's for hygiene as kind of a screening tool. I'm not sure if every dentist in every operatory we're taking blood pressure before administering local anesthetic. But I'm wondering what happens if you didn't and something went wrong?
Well, okay. And they're called vitals for a reason, right? And that's the first thing I always point out is like we need them because they're vital to us understanding the patient's, at that point, suitability for treatment. Okay. So you're right, it is a way to screen that patient. But it's also very important from a litigious standpoint to have that documented because if something were to go wrong, the obvious and almost necessary question anyone's going to ask you afterwards is, okay, the patient suffered some type of cardiovascular event. What was their blood pressure and pulse prior to the incident? And if you didn't take it, you're going to have to answer the three words that nobody wants to say. I don't know. Not only is that bad, again, from a litigious standpoint, it's bad because anybody looking at that, including a state board of dentistry, would say, well, you didn't take the patient's best interest to heart. I mean, you had to take their blood pressure and pulse prior. Otherwise, how would you know if they're suitable for treatment? But also, how would you know that if their blood pressure was already low, that you needed to maybe do something else before you did your treatment? Like you've got to be able to assess your patient, not just for suitability for treatment, but to be honest, maybe they need to see a doctor. Maybe they need a medical consult. Maybe that's the time, like I always say, know when to fold them and know when to walk away, right? So without a blood pressure and a pulse, you're basically practicing in the dark. Now, I know there's plenty of clinicians out there that are saying, Viola, you're out of touch. You don't work in an office. I barely have time to pee and eat lunch. And you want me to take blood pressures and pulses on every patient? But it doesn't have to be you. Get a cuff, train your staff, right? If your state allows it, have delegated to someone else. We should find a way to take a blood pressure and pulse in every patient. Blood pressures are essential, but so are pulses too, because pulses give you a quick bird's eye view of that patient's cardiovascular fitness. If their resting pulse is in the 90s, that's a source of concern for me.
Well, let me ask you this because we all have or have access to that little chart that says what's normal, what's high normal, what's high, and what's like call 911. And sometimes you take blood pressure on a patient and they're like, no, 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 that's normal for me. Or it's a little high, but I'm a little nervous. Don't worry, I tested at home and it's fine. Like, what do you do there? Because there's kind of a gray area there and we still have clinical decisions to make.
I couldn't agree more. One of the first things I say in every one of my lectures is to give you a chart, a little table that tells you what's normal, etc. The first question you have to ask before you even look at the chart is, what's normal for you? Because if your blood pressure, let's say as a patient, is normally 90 over 70, and you walk in the dental office and it's 150 over 100, that's not just, hypertension, that's extreme hypertension for you. So I want to know that in advance so that I know when to fold them and say, okay, we're going to have to walk away on this one because we can't possibly treat this patient. They need the consult. But if you never asked me as a patient what's normal for you, and I didn't tell you, and I'm just looking at the chart, I'm saying, well, okay, it's high normal, but it's okay. We could probably get going here. And that you're walking into a medical emergency. Because again, many times people who tell my courses say, if I had to throw everyone out of my office who had a 150 over 100 blood pressure, I'd be sitting there all day alone. I get it. And there's this thought that there's this magical, mystical force over the front door of your office that as soon as you cross the threshold, your diastolic and systolic jump 30 points. There is something to be said for sitting in a dental chair. It is stressful, but it's not that stressful. That blood pressure and pulse should be that high. So it's an inkling. And if you've never taken the blood pressure and pulse, you wouldn't even know it.
So I was taught if it's high, okay, fine. You take it, then maybe have them rinse with something, like kind of kill time for a couple minutes, chat with them, and then take it again. And if it's still high, maybe have them relax again and then take it again. And so obviously if it doesn't start to slow down, at some point, then it's a little bit high. I think this is a really cool topic to bring up maybe during a team meeting or maybe in a morning huddle to decide for your office and your team what is acceptable for you and what's your protocol going to be moving forward? Because you don't want one to not check it, one to be super stringent, one to kind of understand a little bit more about the patient and, kind of be more appropriate with what they're doing. So I think that everybody should do the same thing, especially in a dental practice. So, all right. Do you care if it's or if it's a wrist or an electronic pump?
So, I mean, of course, my favorite is the sphygmometer, right, with the stethoscope. And what have I learned after taking blood pressures and pulses for 30 years with a sphygmometer and a stethoscope? I suck. I'm not that good, to be honest with you. I'd rather have the cuff because the cuff seemingly is more accurate sometimes than I am. And it takes away some of the variables. I just think having an arm cuff strapped to every dental chair just makes sense. So you can, put the cuff on, hit the button, make small talk. 30 seconds later, you get your number and it's already recorded and boom, you're done. So important to remember that it's not enough to just take the blood pressure and pulse. You got to record it because if 3 years from now, some smart aleck attorney says to you, so what was the patient's blood pressure and pulse that day? And you don't have it written down, you're going to try to convince everyone in that courtroom you remember that patient from that day 3 years ago when you've seen 1,000 patients since. It's just not going to happen, right? So
Definitely no.
yeah.
All right. Well, I'm really glad we talked about this because I think that this will bring awareness to something that sometimes gets overlooked. And if you are taking blood pressure, like I know we do in our practice, it is actually so rewarding when a patient returns after, their next dental hygiene recall or whenever we see them again and they say, I went to my doctor and we actually are working on getting my blood pressure down because you're right. You found, it was high. It wasn't just a fluke that day. So
And remember, Pam, a lot of people don't see their doctor on a regular basis, but they do see their dentist and hygienist on a regular basis because they like their pretty white teeth. If you're the one taking their blood pressure and pulse every time you see them and they don't see their doctor for years, who's really monitoring their blood pressure? It's us, right? We're the ones that are really monitoring the patient's blood pressure more than their doctor is.
So takeaways, doesn't matter if it's a wrist or an arm, or if you're using your sphygmomanometer
That's
and
a
you're, I know, no joke. And, you should have a protocol for your practice and you should do it on every patient every single time they come in, especially if you're administering local anesthetic.
Yeah, the more you do it, the more patients are used to it. So no one's going to complain after a while because they just think it's part of the usual visit. So exactly.
All right. Well, another talking point to bring back to your practice from yours truly at Medical History Mysteries. So we will see you all next week.
Take care, everybody.